Gross, and I'm a structural integration body worker. I've been doing this for 22 years, and structural integration is a very specialized method of moving the soft connective tissue in the body. So you're actually changing the shape of the physical substance and not just moving fluids as is in massage. If you looked at a muscle in a laboratory, you'd see it was made up of lots of long, thin fibers, which are muscle fibers, connected to lots of nerve signals. Those are the things that move us around as the muscle fibers contract and release. Holding them all together in a shape that looks like a whole solid muscle with the blood and lymph vessels and the nerves is another substance called soft connective tissue, also known as fascia, F-A-S-C-I-A. And in this fascia are all these other substances, but it has innumerable tiny collagen, elastin, protein fibers, little gelatinous things that form a shape and then form wrappings around groups of muscle fibers and are wrapping around the whole muscle. At the ends of the muscle fibers, this putty, gelatinous stuff becomes thicker and tougher, connects the belly of the muscle to the bones in what we call tendons. So when I activate this, it pulls on the arm and it moves the arm this way and this releases, or this goes out and this releases. So what we have is a way to move ourselves around with putty and tendons, and the putty gets bunched up. To make a long story short, when putty in the belly of the muscle gets bunched up, it causes the bones to go out of alignment top to bottom, so it becomes zigzagged. And we get back problems and chronic tightness that doesn't go away if you just move fluids or you just try to move bones. You have to re-lengthen the tightness. So what we're going to do is show you on this video how to work the back, the neck, the head, arms to make people feel much more comfortable in their bodies and release a lot of the tension more than just rubbing massage would do in the back, but you can do both. Then we're going to show you how to lengthen the legs, the abdomen, and the chest so that you elongate the front, which has also been short and been misaligned. And we want to make it so that it balances out in a vertical position, and therefore you don't have to keep arching the back and keep creating tightness in your neck. The purpose of the video is to help massage therapists learn more, have more tools in their craft, help nurses help their patients, and caregivers help their patients, and also for everyday folks to be able to know more about their bodies and how to help their families and friends. So one of the things you want to know when you look at a person is what they look like from the side. If people's back are arched like this and their pelvis is tilted down like this, then you know that they're always tightening up in the back and the neck and the head and tightening all the way down the legs, simply to compensate for shortness in the front, shortness through these muscles inside, and shortness on the front of the belly. So if you can lengthen all of this upwards in the front, then you won't have to tighten at the back. The first thing you can do, however, is give people some symptomatic relief, and if you're like releasing the back all the way down, releasing the neck and the head. You will find for many people who have very tight backs, including those who work out, that the lower muscles in the back will be very tight. And you can't do a lot there, and you don't want to just loosen, loosen, loosen. You want to make the whole thing longer, so that if you just try to loosen there, they're going to tighten up again, and it's going to be too soft, and they can even have more pain. So you want to work the whole thing down, and then you want to work the whole thing up. And you can add stretches that I have in my stretching tapes to increase the amount of stretches below and get the legs longer and the interconnected muscles, we call them, so that everything goes more vertical and easier. Okay, so now what I'm going to do is work on this person's back and neck and shoulders and some arms to show you how you can do it just by the person sitting in a chair, because most people in their homes don't have massage tables. So, and also if you're a massage therapist and you have a chair, then you can do some of it in that very easily, or just have them sit on a regular chair. So you have the person lean down a little bit from the head and the neck a little forward, and then you take the back of your hand loosely and you push along the knuckles in the back of the hand. So you bring this down and you let the person relax down forward. As I push down, you just lean your head down and lean your neck down and your upper down. And as I go down forward, you just keep rolling down. And I'm pulling on this big bulky muscle on the side of the spine. And just grabbing a little bit with my knuckle and pulling down, grabbing a little with my knuckle and pulling down. And bringing it all the way down. Now I feel the tightness in her lower back. And you come down. Again, you notice I'm doing it just like inch by inch. Come over the rim of the pelvic bone. My other hand is just kind of like holding up above and coming down. Then the person can sit up. And how does that feel?
Good.
Okay, now I'll work the other side. So you lean down and you lean a little forward. And we're just grabbing the body of the muscle with all the putty and bringing it forward and down, stretching it all the way, coming down. Sometimes I have to push a little harder inside when I feel lumpy. Pushing in, but I'm also grabbing. So I'm not just banging like a massage stroke, but I'm actually grabbing material and spreading it, grabbing putty like window putty or bread dough, and spreading a little bit, spreading a little bit, spreading a little bit. And we come down through here, again, grabbing. I can even get up above. You can drop your head so that the whole back kind of gives way. And I come down the back. Again, my other hand is just kind of holding me there, so I'm not floating up in the air. And you just bring it down here and into the back and the lower back. And this relieves a lot of stress and tension. When your back is tightened upwards and arched backwards, very hard to stay relaxed. Now come back up. And how does that one feel?
Good.
So both sides getting looser.
Mm-hmm.
Okay, now you can even come down the middle and do a loose end right over these bumps. These are not the actual bodies of the vertebrae. They're what are called spinous, or little things that stick out off the belly of the spine, the vertebrae. And so we're grabbing the muscles. There's actually a muscle between them, one to next to the next, and we're trying to lengthen that as well. And you just keep pulling downwards. You could even be watching the video as you're practicing on your family member or your client and pushing this all the way down. And then the person can sit back up. And how is that getting? Is it getting looser all the time?
Yes.
Okay, and so now you can lean forward a little bit. And you see this big shoulder blade? There's a muscle on top of it. So you can grab your hand and pull the shoulder blade and spread it inwards, which is the way the muscle fibers go. Spreading it inwards and coming over here and spreading it inwards. And now I'm going to come over to the camera. And now we go to the other shoulder and working that one and spreading it. And again over here. And now how does that feel? A little better
Good.
still? Loosening the arms right. And now you can work in the neck an interesting way. You first have the person tilt the neck over. And then you take the side of your hand and you come upwards along the side of the neck. So you push in, you hold the person a little bit to ground her, and up. And the back of the knuckles here are spreading muscles along the sides of the neck. And you're just pushing in gently, and the putty will go. If people have vegetarian diets, if they've done yoga, even if they're athletic, it will spread it. You're coming up behind the ear now, on the side of the pinky area, just spreading. And so you're pulling upwards and bringing it up along the side of the head, the top of the head, around the ear. So I'll do the other side and you will see. How does that side feel?
Good.
Looser?
Yes.
Do you feel it by your eyes too, getting looser?
Yes.
Okay, now I'll show you here. You tilt your head over. Then I'm going to push up with my hand and grab it so that it comes upwards and goes into the side of the neck, coming up. and the person will feel more relaxed and stretched. And I can feel as the body worker that it's starting to loosen inside the back. And if the person is sensitive, they will also feel that. You come up by the side of the ear and come over the top, and then you can actually move bones of the head, of which there are 29 or 30 bones, and then they relax. Now how's it feeling?
Good.
And now stand up and see what it feels like standing up. Is it lighter at all?
Yes.
Okay. Now watch here. We'll come a little closer to the camera and turning yourself so the side faces the camera.
Actually,
Okay, so we're just fixing the camera a little bit.
so are we?
Now you can see where the arm is here.
We're not on the camera.
And I'm going to work right here. Pushing in here. And with my fingers, I'm going to kind of zero this in a little bit more for you so you can see what we're doing. And just relaxing the arm. And now you grab with your fingers and you spread it into the muscles on here. You can actually feel where the muscles are, and you take your thumb, you kind of push it inwards. And then you can have the person actually sit down, and then you can also do it by working in here. You can take the back of your hand and push down the arm muscle and down into the forearm, and grabbing and pulling it downwards. When people have sore wrists or carpal tunnel syndrome, all of this up above is pulled upwards, so you want to push it downwards. So in here, you grab this, and I'm just sliding through and then pushing, sliding through and pushing, sliding through and pushing. And again, the back of my hand stays loose instead of a tight fist. We do a looser thing, and I keep my shoulder relaxed. One good way to do it is if you put your mind in your pelvis and in your hand, and you keep your shoulder loose. So my mind is in my pelvis and in my hand, like my hip joint at the side of the pelvis down the bottom here. And I push my hand in here, and it pulls this longer, 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 and elongates it all the way down the arm. And a lot of layers in the arm and the muscles. So you just want to get a little bit to begin with. And if you are sensitive enough, like as a therapist already, you can feel that the person's back or shoulder and neck starts to loose. A lot of people don't realize it, but their arms get tight and they don't have pain. But it's also tight up in the shoulders and neck. So what we're doing here is making all this longer. Now you can drop your arm. How does that feel compared to before? Is it looser? Try the difference between one arm and the other.
Yes, it is lighter.
Yeah, so tension really creates heaviness rather than the amount you weigh on a scale. So you can drop your shoulder, and I'm just going to push with my fingers up and spread. Push with my fingers against muscles, up and spread. So you relax under the arm, you relax the shoulders and neck, and we pull this, and a lot of the tension that's up in there get released, right? Then it comes all the way out across, and we're making the arms, which will also help the chest. People don't realize it, but the forearm muscles are connected to the upper arm bones, which are connected to bones in here, which connect all the way into the chest. So, and up into the neck. So when this stuff is tight down in here, it's going to affect what's up there. So I even wrote a book on how to fix backs called Understanding the Cause of Back Pain and How to Get It Fixed, where I show tightness in the legs, tightness in the abdomen, tightness in the arms, tightness in the head affects the back. One of my teachers in this field said to me, oh, see, now you've shown how the limbs affect the torso. So this is structural integration. People don't realize. So what I'm doing here is working on the back of the hand, pushing downwards, and then the person can turn over, and if you're on a table it's good, but you can also just push down into the palm and spread and push, keeping the shoulder loose and pushing it this way, and the person can just stay relaxed. Now the person can relax. That way you hold their arm for them and you push down on the bicep, which is usually pretty tight for everybody, and then you squeeze right in with your knuckles right in between the muscles in this arm here. You're squeezing in between the muscles and trying to spread them. Same thing here on the forearm. So you can do this on a chair anywhere in your house. And exit, then the person can lie down. Now how's the arm feel?
Good.
Better still?
Much better.
Try raising it up into the air. Is it any easier than the other one? Try the other one. Both together. Now, you can drop your right arm, and I'm going to work underneath this arm. Feel on the back of my hand again, and I'm going to push where it joins in here on the side, and push in the back, and push up in the front. So I'm going to push in here, and have it grab and loosen down the side a bit, and push to the rear, and just find a place on the arm as the person reaches to try to touch her fingers to the ceiling, and I push downwards. And then also the person can drop the arm, and you can actually lift it up and work even with your fingers right into the pectoralis major, the chest muscle, right up into the arm bone, and try to grab it. On a table, you can work through that. And then she can drop her arm. Now, how does that feel?
Good.
Even looser?
Much better.
Lift the arm up. How's the other one feel compared to that?
Lighter.
Lighter, and you can just grab the person out. You can work this deltoid muscle and grab it. The one that, this muscle helps you lift your arm to your shoulder height, up to here. And so instead, what you want to do is notice I'm just continuously pushing down and grabbing, pushing down and grabbing on this big muscle where it joins the shoulder. And then it releases and loosens all the way down. I'm feeling it now loosening down into the side of her legs. And so all of this musculature is connected all the way down from here and then down the sides and into the legs. It's all one network. All the fascia goes from muscle body to muscle body through the tendons. So you really have one big piece of what we call connected. And now I'm just grabbing and making it longer still, and now I'm feeling it go into her neck, and you can drop the arm. Now how's it feel comparatively? Move your arm and your elbow around. Different?
Yes, good.
Okay. To save time on the video now, I'll let you do the other side, and then we'll do something else on the table. Grabbing the thumb, and also with my fingers grabbing and pulling as I get what they call a purchase of the tissue and giving it away. And I can feel my fingers kind of in the elbow joint, pulling. So helpful to do people's arms. It really makes a big difference for everything. Pulling into the forearm, pulling the back of the arm, see with my thumb. You can also work two hands and through here and into the back of the hand. You push onto that, or you can grab your fingers and pull in between the bones, or you can have the person turn the hand over, particularly if you're on a table or on a bed, and you can push in here in the palms and let it spread. So a big thing is working the back and working the arms and working the sides of the neck makes people feel a lot easier. I'm going to adjust the camera.
Here, I'll show you. You loosen it this
loosen
way.
it. Okay.
Loosen it.
Okay.
And then it goes.
Okay, go ahead. And now we're going to work here and just gently grabbing and making it longer. And I sensitivity that this is actually pulling on the base of her torso, where the bottom of the spine comes. So it's loosening the lower back all the way to the pelvis. So her arms and her shoulders and her neck have been tighter than the rest of her body. And so by doing this work, it's lengthening the area all around. And some people say, well, can we do the back of the neck? Sure, you can just come up the back of the neck, spread it again, and then the person feels much more relieved all the way. Please turn around, and in the back, the person can lean down a little bit, and you can come up the corner in the back of the neck. Again, you can see how my hand works, and come along the other side, pulling and pushing with the hand. The back of the hand is loose, remember? We're not making a tight fist, we're making a loose fist. Pushing in this part on these knuckles. So we're pushing upwards, and it's coming up the back of the neck. I'm feeling where there's tightness, so I'm grabbing between the vertebrae and the neck, just as I had done down here. We're pulling upwards and lengthening the person. Now you don't want to do this for somebody just on the neck if they constantly have neck problems, unless you feel all around and work the front and some of the back and the arms as well. Then you can do the neck, and all the intricate parts are released. So again, we're just pushing in here and grabbing so that it goes upwards through here into her neck and head. And then she can sit up now. Does that make it feel any better? Turn your head left and right, see?
Yes.
And turn all the way to the right. No, I'm sorry, just with your head. And now continue to turn with your head to the right as I push in between the neck and the shoulder blade. So pushing in here, grabbing, and to come off the top of the shoulder blade. Shoulder blade's in here. I'm going to work with the back of my hand in here. Some people use their fingers. It's a little more difficult with your fingers. You have a bigger tool with your hand and arm. And I'm not tightening my arm. I'm just using my weight to kind of give a push to grab it. And then some people will make long strokes. I tend to go shorter and more strokes. A little tug in there. A little tug so it helps it move across. So you can see that I'm working here on the edge of the photo, just a little bit over, and now come back, and now turn your head again and see how it feels that way. Is it any looser?
Yes.
So you've worked all the way across and loosened it up. I'm going to make the picture a little bit bigger. And now we'll go on this side, and we'll come across, and we'll work into this area at the angle. And notice I can just notice how my wrist is going. And I'm not going straight in, I'm going shear force to kind of grab the tissue. And now turn a little more to the left. And again, pulling out over the neck and the shoulder, through the shoulder blade, top area, and down and across. And now turn your head left and right. A little more lubricated. And in the back of the head now, we have a lot of muscles here, and they go up over the top of your head in a piece of fascia. And then they go in the front of the head. So I'm going to be moving the camera around so you can see and the angle how to do the head. First we'll make a little bit closer, and you'll see. So you want to come upwards over these bones. We've already done behind the ears, coming up and around. Turn your head, please, will show. And there's a bony thing right behind the ear. And what we can do is work with the side of our hand and push along the bony part that goes up over the top, and then over the front, and then down through the bones on the front of the face. So please face this way. And when we come down, you want to be careful not to push too hard in here. But you can come straight down, side of the face, working through here, all the way down to the jaw, and that will release bones in the side of the head. As I said, there's many bones in the side of the head. You can even work to the jaw here, or just use your fingers. And now feel how that feels. A little bit more loose, right? And more relaxed. So you feel more turning in your head, and you also feel your neck, and also feels lighter, right? Less tense, okay? And now you can face the camera. And now you can loosen up the back of the head. So you push your hand over the top of the head and grab section by section. You can even use your knuckles in here, your fingertips, but it works with the back of your hand best. And you spread it upwards and spread the other part upwards through the head, and the other part here upwards, and it loosens the head, and that loosens tightness on the neck, which all the way down the back. So when you loosen it, it frees up all the way down the back. And we're working on the top part, just pushing it and feeling that it gives way. There's a fissure of bones in the middle. There's fissures of bones on the side, fissures of bones are here. You can loosen it. And the person gets relaxed as you're pushing down. If you do this on a table, you can also have the person relax. But this is how you can do somebody right in a chair, whether you're in a health food store and you do chair massage, or it's at home. And now you can sit up again. And how's the head feeling? Any lighter? And now you can work on the forehead. It's going both directions. So you can take your hands and fingers and push across, pushing outwards, grabbing the tissue of the forehead and pushing it across, or this way, pushing it so you feel it pushing you across and up above. You can work in both this. Just here, like what they call the forward or the anterior fontanelle, where the bones join in, and you just keep pushing with your fingers back and forth, so you open these fissures up, and you're grabbing and tugging it to the side and tugging it to this side. So everything is getting pushed forward and sideways, and the top, and people feel that it loosens their head. And you have acupuncture meridians. I will show you by opening this thing up a little. You have acupuncture meridians that come up through here on the inside of the legs, come up through the middle of the body, and join the head. And then they come off the sides of the head and the front of the face and down the torso and the back, all the way down the back, and they end up in your feet. So you have energies going up and energies coming back down, and energies also are affecting in the arms. Loosen the arms, it's going to loosen the energies going into the torso and the head. So if your head is tight, then the energies that go up get stuck here and they don't release going downwards, and that perpetuates stress. So to correct that, we loosen the head, and it also loosens the tightness of the bones, softens the fascia, and more energy can come in, and people feel that they can process more information, and they're not running around being tight and overwhelmed. So you can work in the front. We'll work a little closer. And you can work, there's a little bone here, so be careful, but you can take your fingers and push on the angle of the bridge of the nose and spread it upwards and then outwards over the eyebrow. And when I do this, I feel her back of her neck and head loosening. And you can come up again. They teach us to be ambidextrous in school, but you can do it with one hand. And then you come over the eyebrow this side. I had one fellow who I'd visit him, and he always had this one eye puffed up. And he had to go to the doctor for the infection, but I would loosen this. It wasn't the eye, but it was the whole area around the eye, and I'd spread it back outwards. And then he got some medicine to clear up the infection. But you can correct a lot of shortness and tightness distortions, and coming up again and opening up. And this actually relaxes the eyes, because we have bones all around the eyes, and when you loosen it, it loosens the tension there. We have accumulated tension in the head, and as I do this, I can feel energy in her legs going all the way down her torso and legs. Now you can go under the eyes and just push across the cheekbone, and pushing in here, section by section by section, across, not just straight in, turning the other way, not just straight in, but spreading it gently, little by little. When you're on the table, you can make a long stroke. But this way, we're just doing little sectiony strokes and a little bit of tugging, and then it's spreading. Underneath here, in this area, there's a notch and a few acupuncture meridians join there, but also it tends to be painful, and some people you have to be careful. But you can open it, and then a lot of the bones of the face release. So I'm feeling her eye let go. Hers is pretty loose to begin with. You can go over here near the front of the nose. You can go across the upper lip. There's a muscle that goes around the mouth in a circular motion. You can find an anatomy book, or even online on my website, BackFixBodywork.com, on the links page. There's an anatomy area. Gray's Anatomy, which is a very famous book, is now online, and you can get pictures and information right there for free. And there's a link. So you can push down here and push across and feel it come up on the side, and I'm loosening all of this and loosening into the back of the jaw, which where it joins the neck. And now how's your head?
Good.
Is it getting looser? Are you
Yes.
feeling less stressed, more relaxed?
Yes.
See, so you want to get all this thing. It's a great stress reducer. So your husband and your wife comes home and they go, oh my God, I had one woman, they were multimillionaires. He was a curator for a very large museum. And when I worked on her many times, she not only felt physically much better, but she said, oh, my husband comes home, and I used to get very anxious because he has a very stressful job. His boss is pretty strained. And so now when he comes home, it doesn't bother me as much in my guts or in my chest and heart, and I can communicate with him better and be more caring. Well, wouldn't it be nice if she had this kind of technique? She said, honey, come on, lie down. And she makes him a drink or a carrot juice or whatever he likes, and just does some of this stuff on him. And he goes, wow. And then he feels better than even before he went to work. And it lasts because you're moving a lot of bunched up tissue. You're not just moving fluids. So it'll last. One man was under stress for his big government job, and he said it lasts for 2 weeks, whereas it used to only last a couple days for my massage. So massage therapists can add to their repertoire by moving the connective tissue in this organized manner. So I'm just pushing on this area to loosen around the face, in through here, and behind the neck, and then down to the jaw. So you can add this technique and specialize in stress removal in part of your sessions. And then you can, nurses, this would be great to work on nurses, work on doctors that you know, and work on your patients. I had one woman who was a intensive care unit for our operations. And people would come in, and in the beginning she'd want to rub their backs, but she said, I don't know how. And they would say, no, nurse, it's okay. But once her body and her arms and everything got loosened herself, she was able to do this much better. And she said people were saying, can I be next, nurse? So it's a very nice thing to do. Now dropping your head a little bit. Again, we'll come up through the middle of the head and pushing right along the middle line. And it spreads easier now that we rub the head. So you do the back, it helps the front. You do the front of the head, it helps the back. Pushing right here in the forehead on the top. Now it's helping the whole thing, even down the back. So you just go round and round and get the whole thing, all this putty, to loosen. And then you come back up with your head. And now how's your head feeling?
Good.
More relaxed?
Yes.
Okay. And turning your head left and right. And notice it goes even a little further now, right? Now, one of the things that people don't realize, they're very pleasantly surprised, is I'm going to show you by lowering this. The chest muscles affect the neck. I'm going to make it a little closer. And you have pectoralis, massage therapists and nurses know, they go from the breastbone out to the collarbone and over to the shoulder at both sides. So if this is tight in here, it's going to be pulling the person inwards and keeping that neck from rotating. So we usually think only the neck and the back, and maybe people think of the head. But now I'm going to show, now just turn your head as far as you can to the left. Notice that's where it hits tightness, and go as far as you can to the right. And notice that's where it hits tightness. So now you go straight ahead, and I'm going to take the back of my hand gently. Now if you're on the table, do this, or you can push with your fingers. And I'm going to grab across and spread it right across, and because she's done a lot of yoga and I've gotten a lot of massage, the tissue's very soft, and I'm just grabbing right into the arm. You can see I'm just working right across from here to here to here, and it's opening up. You can feel the collarbone under part of my knuckles, so I'm pushing along it. You can tell, therefore, I'm not really grabbing and pushing hard. I'm moving it softly. And we're grabbing across, pulling it across. I can feel as I go a little deeper now that it's loosening more of the bones, and actually the back of the chest, meaning the upper back, is starting to let go. And now it's even easier to work down over that deltoid muscle into the arm. And this is actually loosening in the middle of the back even better. Who would have known, right? Now turn your head left and right again, see how it feels. Still tight on that side, but freer on this side, right? And we guarantee that if your head comes off, we screw it back on. So now we go on the other side, and we push across, and now I'm working the back of my corner of my hand. If you're standing on the other side, you would pull on the table. But right now I'm just pushing across in the chair to grab with the back of corner of my hand in here. And I'm just pushing across the chest. And tugging, you can actually tug a little bit, and pulling it across the pectoralis muscles, and you can actually feel it give way. If you're sensitive, you can feel it give way off of the breastbone as you tug, and your attention, your mental attention, is inside the chest of the person. And I've done this watching TV, been at the beach. It's very easy, and you just grab right across, and the person feels it. We're going right into the arm again, and we're going to go a little deeper to open the back again, opening the back. And I have a video where I'm showing you how to do it under your own clothes with your hand, if you haven't seen that one yet. And then we go down the arm, and the person feels, oh, that was a nice release in the upper arm and the back. We're just grabbing across, coming down. So you can kind of do this even with the person sitting in a chair. And now check your chair and turn left and right. How's it feel?
Better.
Is it better? Easier, right? And you can even add to it by taking your fingers and just coming right down. I'll get it a little closer now with the video here. You can just take your fingers and go right on the side of the front. There's the Adam's apple. That's one of the things. You can go right in the side here and push. One of my classmates developed a technique after we graduated, and he said you could just go really in there, go right across underneath the throat, underneath all of those tissues, and it really opens up everything inside the person's head and torso. So you can just grab in here. Then you can grab right along the top of the collarbone with your fingers and gently push in and come across the top of the collarbone, pushing inwards into the muscle, downwards, and coming across. You can also take your fingers and go, people when their heads are forward, there's a little muscle underneath the collarbone. It's called the subclavicle. People know that the clavicle is the collarbone. And you can push your fingers gently up underneath the bone, right in the corner near the breastbone. And you're pushing it upwards and trying to loosen that, grabbing it across. And this is also across underneath the collarbone where the pectoralis major joins into the collarbone. So you're actually getting another level of depth. And when you get out a little further, there's a little notch. And you can push your fingers in there, and in that notch, there's a piece of shoulder blade which comes out over the front. And you have other pectoralis muscles called pectoralis minor underneath, which attach to ribs 3, 4, and 5. And if this is tight underneath, I'm going to move your shoulder. It's going to make you come down like that. So you want to lengthen all of this so the collarbone is straight across and the shoulder blade goes back in the backwards to where it goes, and this muscle is then long enough. And then the people feel their chest is more open and their head goes more upright. So many people forward, particularly people who work and lean their heads over desks and computer screens and everything. So we're loosening this. And by the way, when you're working in here, it really helps around the eyes for computer screen tightness, and also with your arms. When we did the forearms and hands, it released stuff from the keyboard. And now take a deep breath. Is it getting any better?
Yes.
Now I want to focus in on the hands. So let's see. If you move your hand up like, I want to show something since it's full forward. If you push your fingers into the back of somebody's hands like this, you can push between the bones that are in the back of the palm of the hand, and then you can turn the hand over, and you can push in here all through these bones, and just grab this tissue and grab it over here. And if you want, you can push with your hand and spread it apart with your knuckles. Then you can fingers and grab the person's finger and just squeeze, but not just squeeze, but actually milk it. Try to squeeze the muscles along it, down toward the finger, on the top, underneath, on the inside, and on the outside of each finger. And these have tendons which go all the way into the forearms, so when you can lengthen these, people feel their forearms and the interconnections all the way up to the neck and the head giving way. So you can do all of that, and you can actually grab them and pull, and then people feel their arms give way a little better. And you can drop your arm. How does that feel?
Good.
Looser as well, right? Now please stand up. We'll adjust the camera. And feeling standing.
Very good.
Do you feel more upright?
Yes.
Okay. Now when the person is standing, you can continue to do that if you're skilled. You just take the back of your hand again and go underneath the breast area to the lower ribs. If you're technically inclined, you know there's something called serratus anterior, anterior meaning in the front. And it's a muscle that comes from the lower ribs around the side of the body and attaches to the shoulder blade and back. So you've got this stuff in front, then you've got it connecting to the shoulder blades in the back. You've got the muscles between the shoulder blades in the back. And then you've got this stuff around the sides of the ribs here, which connect to the shoulder blade in the back. So you've got kind of a vest. And so we can take this and just grab it, or even push our fingers in and grab these muscles down below. We'll give you a little bit better close-up here. And grab this stuff in this area to pull, and then go around the side and pulling over here, and even pulling upwards on the side, and I'm using my fingers, and going all the way around in the back to the shoulder blade. And now dropping your arm. Did that make it feel a little looser still?
Mm-hmm. Yes.
So come over a little bit this way, and then we'll do the other side. And since I'm right-handed, a little bit more awkward for me, but it was on a table, I could come across and go through here. And this is also going to help the back, because it releases this bottom area a little bit more, and then the person can get some relief along the side. And out to the shoulder blade in the back. Dropping the arm, and you can just come right around and underneath the shoulder blade. Now this is not the whole sequence of strokes in the structural integration sequence for these areas, but it's an awful lot. So you'll be able to keep the body what we call organized and loosen the person. Now I want to show you something here in the back, and I'm going to make this a little bit taller here. And notice, if I turn a little bit this way, move this arm a little bit, if you can, that there's a bit of an arch in the back. Turn sideways again. And there's an arch, kind of an arch. I'll make this a little closer and drop the video down. What we've done is loosen a lot of tightness that accumulates regular activity, and also because the person is what we call misaligned, that it keeps making her tighten her back. But so I'm going to show that a little bit to you. And you can see, when you go this way, there's kind of an arch in the back of the body. And the pelvis is kind of sticking forward a little bit. And so you can feel in the back for somebody, see if there's a notch, N-O-T-C-H, in here. She doesn't have a notch, so that's pretty good. But also notice the shoulder blades, they're a little bit, how you can do it, is to tighten your back muscles and tighten between the shoulder blades. So we have caused a lot of looseness now, and when she lies down or sits down, it's very loose. When she stands up, these other tightnesses come into play, and therefore she has to do this arching again. But it's a nice tune-up to begin with. Now we're going to go onto the table, and I'm going to show you how to loosen some of the causes in the abdomen, in the legs, more in the chest, a little more in the neck and head. And you'll see, so you can grab in here and push back and forth, and please sit down. You'll see that you can work even into the neck to loosen it. You can grab up here and squeeze down here. Often a friend will be sitting at a desk and I'll go in here, somebody will work me, and the old adage is I'll give you an hour to stop that. And just sitting there and work on his arm. And sure enough, it got better in like 15, 20 minutes. Altogether, that's all he needed. And he said that they massage each other at night, either sometimes both of them the same night or they alternate nights. And I'm sure oodles of more couples do that. He says they get closer, intimate, it's quality time. And it's really healthy for you, see? So then you can work back down the back. So this will give you some more knowledge. You can put your fingers there, and you can work out over the shoulders. You can loosen the head. And when you're used to spreading the fascia with your finger motion, it feels really good. You just don't want to just squeeze. You want to grab a little and push the tissue and spread it at the same time you're squeezing it. Now I want to show you something else. It'll be hard to see on the video, but I want to point something out. It's very common. Now remember I mentioned something about a notch in the lower back? Well, some people also have a notch in the neck, right here. So between the muscles in the neck, there's an indentation in the spine. And that's because the neck muscles in the front are too bunched up. So they take the spine, which is in the middle, and if you bring your head back up, please, then this part forms an indentation right in the middle of the neck. I never noticed that before a few years ago when I started working with some people, and I said, oh yeah, look, they have notches. I even see that on actors on TV. You get a notch here, and you get a notch down on the bottom, and you'll see that the erector muscles are bulging on either side of the spine, and that's because the muscles in the front are too bunched up tight. And when people work out a lot, they're going to have that. So this is kind of hard to fully get rid of, but with stretching along with body work to keep it soft, you can make it longer. Okay, so now I want to show you a little bit what I did while the person is lying on the table. Okay? And so you'll be able to see me on a big screen. And what you can do is take the back of your hand and pull around the side of the torso and in up through the middle of the chest. You can push up into the breastbone here, and I'll make it a little closer so you can see. Right here, coming up and coming over the top of the chest, pushing in. You can get a feeling that it's grabbing and spreading in both directions, and pushing up on the collarbone and spreading it across. And then you can get a little bit more leverage than if the person was just sitting up. And this you can do even on your bed. You can do this for an elderly parent, someone stroke. I once worked on a stroke person for 3 or 4 hours. She was then moving herself all around, smiling. She really liked the whole benefit of it. And you can push with your hand now on the side of the neck and push it down the side of the neck as the person turns the other way. So you lightly, now you turn left, and you feel that's muscle underneath your hand. and she's spreading to the left, and you grab it, and it spreads it apart, and oh, it makes her back much more flexible. And then you come up the back, so you work with the fingers, and you come up the back of the neck by the head, and then you can come over the front and down into the arms. And so you can just get a nice looseness. I'll go around the other side and just relaxing, and you can see from this angle, I come across the neck and push it down, and she turns her head. As her head comes across, and you can push it down, and then you can work up the back of the head. It's pushing upwards, so you come around, then you go back up, and you keep your fingers loose and your arm loose. Your mind is in your hip joint, and particularly with somebody who has soft tissue, it just gives way nicely. You can work across here and down into the lower area here in the ribs. And in fact, you can see that her head, if you were here, you would see her leaning backwards. So you want to notice that you've made everything longer. And you bring your hand in here. You can come across and down the arms. And one other thing you can do, as you come across, you can feel it's getting deeper, right, as you're lying here. You can bring this arm up. And remember I said something about underneath. You can, as she reaches for the camera behind her, I'll come down on the side of the arm right here. I'm just holding her abdomen to rest on it, and I'm coming side of the arm, underneath the arm, to grab it and spread it. This is called the top of the latissimus dorsi, which comes down the back to the lower back. And then you can take your hand on the top and work the pectoralis major, grabbing it and pushing it upwards into the other arm. So you're just grabbing it here, and that makes it even longer in here, and you can bring your arm down, and that's much more comfortable, right?
Right.
And then you can go over here as well. She can bring her arm up, and you can just, you know, it doesn't matter. You can go down or you can come up on the latissimus dorsi. She's doing the stretching, which is the key thing. You're coming up along it on this big lumpy thing on the side of the arm, and it's coming upwards. That helps free the shoulder blades, and you come in the front here, and you pull on that pectoralis major muscle, and it comes up and through here, and it just is a nice action, and it helps to loosen the back of the neck. And if on the head now, you can take your fingers and you can work on both sides here. You can work on the face and pushing your fingers there. You can work around the mouth. You can work on the other part. Notice I'm just moving my fingers sideways and releasing it. And now you can bring your arm down and take another deep breath. Breathing deeply, you can tell whether the person's deeper enough. Now when you do the next one, you will see how lengthening the abdomen makes the chest move, because the abdominal muscles connect to the rib cage, and you want to make that longer. When you make it longer, then the whole torso will be able to elongate. Because